So hi everyone, my name's Michelle from Holistic Pillars, and today I'm really excited to be introducing Dr. Z. Welcome, Z.
Thanks for having me, Michelle.
So I'll start off by saying that Holistic Pillars, which is the platform you're watching this video on, is all about a story and a transformation. So how I and my husband went about going from, basically not being in very good shape to transforming our lives. And I'm going to preface this by saying this is an informal chat between doctor and patient, and really the support that I was after and how we sort of built teamwork going forward. So first of all, Z, what is your background? What is your medical background and specifically your interests in medicine?
Yeah, thanks. I'll try and be brief because sometimes I can waffle on about these things. But basically, in a nutshell, I've been working as a doctor for nearly 20 years, having gone through Monash Uni, did the obligatory sort of time in hospitals before I settled in on general practice. Started training for that about 10 or so years ago, having initially started down the emergency medicine pathway, but went for GP instead for the lifestyle. And basically I've worked in general practice for the last 10 years or so, with quite a few interest areas as well. I like being a generalist when you know a little bit about a lot of things, but I also like knowing a little bit more about a few things. So sports medicine is one of those. I worked for an AFL team for many years as well. And obviously preventative medicine and nutrition, and weight loss and sort of chronic illnesses that come around those sort of things is pretty important to me. But yeah, I enjoy all aspects of general practice, but that's sort of my background. I've done some sort of further postgraduate study in public health and tropical medicine with the Masters through James Cook Uni as well. But I'm constantly trying to learn more about my field, both through formal teaching and also mainly from patients that I see. So that's kind of me in a nutshell.
Fantastic. And I know that you've got a particular interest with low carb. Is there a little bit of background there as to how low carb became an interest to you?
Yeah, I mean, like I've said to people before, I don't like being pigeonholed as the low carb or the carnivore or the keto or whatever diet it is, because it sort of boxes you into a bit of a corner. I just see low carb as another tool in the armory that I can use to try and get patients their best health outcomes. I suppose for me, a personal journey for me involved my own weight loss and my own sort of health journey where I improved my health, and along the spectrum of nutritional templates, low carb template works better for me. But essentially it's about eliminating all the rubbish and the processed food from our diet, and gravitating towards a slightly lower carb diet, but most importantly quality. So that's kind of where my interest is in from that point of view. But yeah, it's very much an open collaboration with the patient in terms of what is best for that individual rather than what works for me should be replicated.
Yeah. I'll just go back a little bit now. The background for me and my husband, as you know, we found you, I think, around about 6 years ago, nearly 6 years ago. And we'd been going through some massive illnesses and trauma for us personally. And I went about researching options. I said I was sick to death of going to a doctor and getting mainstream, getting a pill to fix a symptom or something like that. So I went about searching or researching everything I could possibly think of. And in that search, I found you. Now, I went along and I made my appointment with you, and it took a few weeks before I could see you, but I was told to come along with my blood work and a food diary. And I remember making the appointment and walking in for the first time, and I was just I was petrified and half excited at the same time because of the journey that we've been going on. And I guess for me, it's like you saw two lunatics walk in. They were in a bit of a bad way. What do you do? How do you peel the onion? How do you where do you start?
Yeah, look, to be honest, it's not a difficult one for someone in my position, because all those fears and perceptions and emotions that you have walking in, a lot of that's projection on your part. By no means did I think I had two lunatics walk into my room. In fact, I just saw it as two patients coming in, and the beauty of general practice is you don't really know what you're going to get when someone walks through the door. It could be something, it could be a cough or cold, which is very topical this year, but it could be something like that. It could be someone going through a pregnancy. It could be someone with chronic illness. It could be someone that just needs some paperwork done for a driving assessment and something along those lines. So you're always sort of kept sharp because it could be different. Obviously, I think the time that you were and Paul were coming to see me was when there was a fair peak in some of the consults around low carbon diet. So I found a lot of patients would get frustrated if they see me, then they'd want a quick result, and I'd always be very sort of firm that I can't give a management or a nutrition plan without first knowing the complete picture of the person, which involves having a chat with them first about what it is that they are, what makes them tick, and getting a little bit of information through their pathology or their blood work, and also some an idea of what they're actually eating before I recommend changes. So that's why sometimes I get people to bring those things in, and that way we can fast track things. But look, to be honest, you and Paul were easy to deal with because you'd already taken the sort of initiative on your behalf to come in with an open mind to see someone. Having said that, I'm not necessarily the right person for everyone, and there's plenty of other doctors that you could have landed with who would have meshed with you and helped you deliver your goals. So there's thousands of GPs out there that do that. And look, I'm also part of that mainstream medicine, and we've got to be careful that we don't typecast people as mainstream or not mainstream. But you guys did the hard work. You guys came in with an open mind. You guys came back saying you want control over your destiny. And really, it was quite easy just to help guide you back on the path. You guys did all the hard work. I just sort of was in the background like a coach. So, a good team has players that do all the hard work, and the coach is just there to sort of keep them going in the right direction. So that's kind of my role in this whole situation.
Yeah, good analogy. That was awesome. But I do notice that with you definitely, when I say peel the onion, you didn't just give us a peel and off we went. Like, you actually, it was almost like going and having a counselling session. So you were definitely having a holistic view on our health overall. And like you say, we had done a fair bit of research in the first place. And with all of the study and stuff that I'd been doing, I understood a lot more about metabolic health and all of those sort of things. So if you, go on.
So yeah, you're right. I was going to say, sorry to cut you off, but when patients typically sort of, I guess, in your position have sort of done some research of their own and got some ideas, and there's a lot of excitement and exuberance that is like, all right, well, I can take charge. It's all guns blazing, and the reality is, my job is just, and it's not for everyone my style, but it's very much to slow them down, because we want long-lasting, sustainable changes, not something that you can do over 1 or 2 months and then it goes backwards, or constantly searching for the perfect way of living because you just do the best you can. So, and like in medicine, being a generalist, it's good that I can take a step back and look at the overall picture, because health, weight, psychology, upbringing, culture, everything is interconnected. And if you focus too much on one area, I mean, sometimes you need to really hone down on the most immediate issue and concern. But once you can get over that sort of acute phase or that crisis point, it's really about looking at everything from multiple angles and incorporating as much as you can about that person, whether it's their health or even their idiosyncrasies, or summing up the way the patient's going to take your advice, and knowing as much as you can, and then incorporating that back into the management plan, and having sort of a collaborative approach where you both keep each other accountable, so the doctor and the patient. So it's not just do what I say and everything will work, or it's not just a case of appeasing the patient as well. I like to think that I develop a pretty good relationship with my patients, particularly the ones I see over a longer period of time. But at the end of the day, my main priority is the patient's health. I'm not here to be anyone's friend, although, you know, friendship-like relationships can develop, or that rapport can develop. But my first priority is making sure the patient's health looked after. So I'm happy to be the bad guy if I need to. I'm happy to sort of question some of the motives, and when patients aren't sort of, when patients are going off track, just bringing them back to it. But that's the main priority. So look, to be honest, you and Paul were easy because you came in ready to make changes. And a lot of times people come in and I see them once or twice and I never see them again. That's okay. And they come back sometimes 6 months or 12 months later. I'm always happy to pick up from where I left off. It's not, I don't take it personally if a patient says they're going to do all this stuff or see me and then I don't hear from them for a year. That's fine. But, you know, life gets in the way.
And I remember the first, I reckon the first year, so the crisis was more around Paul at the time. So, but then, and I think we came, I swear, it was almost like every month for the first year. And then it was like, okay, we've got him under control, and then it was starting to work on me and realising that maybe I needed a little bit of support, emotional support and all that sort of stuff. So I then started going, okay, well, maybe I'm actually not travelling too well myself with some metabolic health issues. I was more interested in understanding in this whole journey around when you talk about metabolic health or inflammation in bodies and all that sort of stuff, which is causing the diseases in the first place or the conditions in the first place. With the blood work, like what's the alarm bells for you? Just very high level for people sort of, you know, looking for. So we do blood work and everyone's banging on at the moment about cholesterol levels and, you know, all these things. So what would you be looking for?
To me, it's the trends, to be honest. And unless you're talking about blood work in the setting of an acute illness, so if someone's coming in with an infection or, you know, pancreatitis or some illness that is an acute issue, or, you know, blood work when used in a hospital setting for heart attacks and these sort of things. Unless we're talking about that, a one-off blood test doesn't give you a lot of information most of the time. And obviously there's a lot of caveats to what I'm saying, but when it comes to chronic health and metabolic illnesses and these things, these conditions, they develop so insidiously over many, many years. It's like getting to a summit of a mountain on a very, very low gradient. So you just travel for a long period of time. And then what happens is patients want to improve their health and they want to actually abseil down the other side like it's a cliff face and get to the bottom as soon as you can. And my big thing is take your time to get down so you actually stay down. So coming back to blood work, it's about looking at trends and looking at it from an individual lens. What one parameter is for one person or one patient, it may have a different connotation for someone else. And you could pick a HbA1c, for example, of 5.5, which may be on the cusp of pre-diabetes. But if I just do one reading on a patient, 5.5, I don't know if that's been going up over the last 3 months or 3 years or coming down. So a 5.5 for someone whose HbA1c was at about 6.5, 18 months ago is a massively positive result, whereas someone whose HbA1c has been less than 5 and all of a sudden jumped to 5.5, that's a big issue to know why it's jumped there. So the number itself is not important, as is the trend and how it incorporates with everything else that's happening in their health.
Yeah, I was interested very much because I had high cholesterol, which I now know is not that much of a problem. It's more about the composition of the LDLs, like HDLs and triglycerides, and all we were aiming for was getting my tris under 1, and that's my focus, right? That's how. But we noticed that the low carb diet in particular, which is one I've adapted very much so I would go very low carb, that's my preferred way of eating, has really supported being able to get those. I was pre-diabetic, I had eczema, I was high cholesterol, And you and I were really focusing on, or I was focusing on the repetitive numbers, so the trends, to your point. Is low carb, in your opinion, supporting the inflammation or the reduction in the overall blood markers or blood work?
Yeah, look,
and things like that.
Yeah, I mean, obviously every patient and every scenario differs, and none of this constitutes direct medical advice, and it's just for informational purposes only. However, even a high cholesterol, for example, or something that's beyond the parameters, it has to be looked at in conjunction with everything else. So a patient who's, for example, smoker, who has high inflammatory markers, who may have high blood sugars, who has a high cholesterol, that's an infinitely different picture than someone who's lean, eats very cleanly, has no risk factors, metabolic markers in terms of inflammation and all that are way down, and has a high cholesterol in the setting of a nutritional template that does not necessarily promote disease. So you can't really compare the two. But yeah, there's a lot of nuance to cholesterol. I don't want this to turn into a long discussion about ins and outs of cholesterol, but it's certainly important to understand the relevance of where the data's trending and how it incorporates with the rest of the picture to get an accurate assessment of where you go next. And even things like cholesterol, if they're high and it needs to be addressed, these things would have built up over a long time. Not necessarily even cholesterol, whatever the marker is in chronic health, would have taken a long time to get to that point. So we have the ability to take stock, take time, and work out our best strategy moving forward rather than a reactionary knee-jerk type situation of you got to go on this, or you got to take this pill, or you got to go on this, you got to try lifestyle factors for 3 months. If that doesn't work, we're going to go on a pill. The lifestyle factors should be really explored in a lot of detail to make sure we're setting up the patient for success, not failure.
Yeah, definitely. So there's a lot of confusion, frustration out there in general around medicine, and particularly at the moment. And throughout our journey, so it's been a number of years, throughout our journey, I get asked all the time, like, where do you start? Like, what do you do? Like, where do I go? So I'm going to ask you, off the top of your head, what are the top things to get started to make some kind of transformational change?
I think the analogy I would use is for someone who, just say someone's got an interest in creative writing, right? They can start spending a lot of time looking at blogs or reading books about how to write, which is important. But then they're not actually getting on to the actual writing part of what they want to do. The creative, you can't be a creative writer without writing. You can study all the theory, you can read all the books, you can listen to all the podcasts or the blogs about what makes a good writer. But unless you actually make the decision to start writing, no matter how good, bad, or ugly it is, you're not actually moving in your journey. And look, fine arts and all that may be slightly different to what you want to do with your health. But I often find patients who've spent a long time mismatched with what the ideal or lifestyle is for their health, and then all of a sudden they decide to make a change and it has to be perfect. They have to learn about the best diet and the best way of doing everything perfectly, and it becomes obsessional. That's almost like you're setting yourself up to fail. So the first thing is to just start and find whoever it is that helps you along your journey that you trust and is sort of calm and can be accountable for you, can show accountability for you. And the problem at the moment is we're in this age of information with the internet, which doesn't always, there is a mismatch between knowledge and information. And I think throughout human history, there's always been confusion about things. It's just that we're more readily able to connect with other people in very quick time to discuss these and see these stark differences on all sorts of opinions. Whereas, 200 years ago, you had your small village to discuss it with, or your small city. Whereas now you can discuss with potentially anyone in the whole world, any issue. So think about how Christmas usually is at a family gathering at Christmas time usually is, how many different opinions there are. Now, just exponentially raise that with the rest of the population. So there is a lot of confusion, and that's normal and that's healthy. It's just deciphering what works best for you and trying to find a good blueprint to start with. And sometimes that is people that you trust, or sometimes it's people that have no emotional sort of connection to you, so they can be objective in helping you. But I mean, obviously I'm biased. Being in the medical profession, I always advocate for people to have a relationship with a GP, even if things are going well for you, because you never know if something goes wrong. It's very easy and it's a lot easier to go through a health crisis when you have a relationship with a GP or someone that you already trust, because you don't have to you can cut through all that time wasting of the worry about, oh, what about this person's advice? So if you're someone who's young and well and you just pop in and see a GP once every 6 months or once a year, and you have a trusty relationship, and something untoward happens all of a sudden, it really has a positive impact in terms of where you can get to. Whereas if you sort of being self-sufficient, which we all like to be now in this age, it can have its drawbacks as well. So that's kind of my perspective on that.
One of my biggest things that I've always said to people is surround yourself with your support crew, whoever that is, because there's more than one way to see that. I've been working alongside Vicky in the nutrition space, alongside my low carb, and between her and you and my personal trainer and my naturopath and a number of other people that have surrounded us. So I think that's been key as well, like building that support crew. And so my other bit of advice was also a bit like you, take your time and then just create. People just focus so much on just one component, like nutrition, instead of going, okay, well, there's obviously a lot of stress related to lack of sleep, or, we need exercise as well, and we need to have some mindfulness and all of those sort of practices.
Yeah, I mean, you don't want to overcomplicate things either. So I think simplify as far as you can to get results and to function without going any simpler is the best way of doing it. And look, just talking about, I'm not sure if it's going to pop up as one of your other questions about, from my perspective, what makes a good doctor or a good GP. And it depends on whose perspective. If you're talking from the patient's perspective, the ideal doctor is someone who is knowledgeable and is experienced, but is also not set in their ways, so happy to learn more information, up to date with studies, has a great breadth of knowledge base, is empathetic, has good sort of interpersonal relationships, and is someone that's almost always available. Now, that doesn't exist in the real world. You're not going to have that's a TV doctor on one of those sitcoms or one of those shows, ER, where the doctor off shift goes to the patient's house, to check up that their groceries have been done. I mean, that doesn't work like that in the real world. So it's about working out which of the ones in that sort of category, in those categories, are non-negotiables and which ones are most important for you. And it depends on the patient and the problems as well. So for some people, they don't really care about the interpersonal nature of the doctor, as long as they're knowledge based, and if it's a technical skill like a surgeon, sometimes patients are more interested in making sure that person is a very good technician rather than how well he speaks to you. But these days, it's not one or the other. But yeah, they're some of the components, I think, that go into make a good doctor. And by no means am I any of or all of those things at all. Like, I've got massive gaps in my knowledge, and I'm always constantly trying to learn and fill them. And I think if you find a doctor who's comfortable with that and can acknowledge that, then you know that he or she will be going on to do the best by you. But if someone who's ego driven, then you can run into trouble.
Absolutely. And I think one of the biggest and best things is the fact that we've been able to work together So I think that we've just formed a team for the betterment of all of us, like as in Paul and I, and then ongoing, like we've reversed all of our issues. We're happy and healthy, and you know, obviously checking with you quite regularly, and
yeah. So once upon a time, it used to be patient care or medical management was very doctor-centric. So it was, particularly in hospitals, it's the doctor and the allied health around them, but really it should be patient-centric care. And the doctor is just one component in delivering that sort of healthcare for the patient. There's a lot of external providers as well, and other people that are non-medical that go to making the patient get to where they want to with their goals, or helping the patient get to where they want to with their goals.
Fantastic. I have almost run out of anything else to ask you at this point in time. I think we've covered it off really well. Yeah, in a nutshell, I think that build the team, take your time, educate yourself enough, and form a relationship and chip away at it like you did with us.
Yeah. Basically it's not going to be smooth sailing. There's going to be hiccups along the way. It's not perfect. Things will pop up that you never expected. Other things may not be as daunting as you thought they'd be. And it's important to not be too focused. I mean, yes, we have to be goal focused and want to get to an end point, but we have to also not waste time in the sense that we don't sort of appreciate what's happening in our lives at the time while we're on this path to getting to where we want to. So thank you for having me on, and it's been a pleasure being involved in your care and Paul's care. But like I said before, the two of you have done all the hard work. I've just sort of been in the background helping out when I can.
Yeah, beautiful. And it's obviously with my now passion with health and wellness and all that sort of stuff, to get on this platform and to educate others is my main motivation. So thank you for being part of that too, sir.
No problems.
Catch you soon. Bye.